In part 1 of this video, we talk about the spleen, its site and size, splenule, the splenic vessels, the vascular distribution of these vessels to segments, and so on. Now we are talking about the splenic ligaments, which is a really important topic when talking about surgical anatomy, because these ligaments are all excised or divided in order to perform splenectomy. Anatomical box, our anatomy box speak about 8 ligaments: the gastrosplenic, the splenophrenic, splenorenal, or the ligaments, the ancient or the older name, pancreatocosplenic, pancreatocolic, splenocolic, perisplenic fold, and the Phrenicocolic ligament. But here we'll just talk about 5 of these ligaments, which are the cardinal ligaments. First, the gastrosplenic, the splenophrenic, the splenorenal, also the splenocollic, and lastly the Phrenicocolic ligament. We will talk first about the gastrosplenic ligament. Gastrosplenic ligament is a ligament between the spleen and the stomach, from its name. There's some information about this ligament. First of all, it's a triangular ligament. You can see in this diagram. This is the gastrosplenic ligament, and its apex near the upper pool of the spleen, and the base is the wider base near the lower pool. This tells us that the upper pool of the spleen is really close to the stomach. So when performing dissection in this area, you may injure either the stomach or the spleen. So be careful in dissection in this area. Also, the section actually is easier in the lower, wider base of the ligament. This ligament also have 2 important structures passing in it, which is can see here the short gastric vessels. This is the excised or divided gastrosplenic ligament. The short gastric vessels near the upper pool, and the gastroepiploic, the left gastroepiploic vessels near the lower pool. So this is a vascular structure. Actually, it should be excised between clamps or using a harmonic or whatever appropriate to ensure hemostasis in this ligament. The second ligament is the Splenophrenic ligament, number 2. This one. This is the Splenophrenic ligament between the spleen and the diaphragm. It's important to know that this some authors thought this is not a true ligament. It's just a part, we can condense it part from the gastrosplenic ligament. Also, it may be containing a fleshy part or a sling of muscular fibers from the diaphragm. So the section here also must be meticulous, because it may need a lot of hemostasis. Traction of the spleen downwards may cause avulsion of this area. So take care when you are performing traction of the spleen, not to cause avulsion of the splenic capsule in this area and cause marked bleeding. The third ligament and third important ligament is the splenorenal, or the ligaments, as we said. It's between the spleen and the kidney. Actually, this diagram can show it more comprehensively. This is the spleen, this is the kidney, and this is a cross section, of course, stomach, and this is the gastrosplenic ligament containing the short gastric vessels, and this is peritoneal flexion is the splenorenal ligament. As we can see here, it's connected to the kidney, and it contains the splenic artery and vein and the tail of pancreas. So this is a very vascular part, and actually it covers all the hilum of the spleen. So the section here is important. You can encounter during splenectomy this ligament from 2 approaches. Either if you are dissecting in this direction, dissecting the gastrosplenic ligament, you will approach the hilum of the spleen from the front side, and you'll start your dissection like this. Or you can approach it from other side if you are retracting the spleen to the right to deliver the spleen outside the incision. You are inserting your hand in this space and grabbing the spleen moving it to the right in this direction. So you can imagine if these structures are reflected to the side, so you will encounter the this ligament from the posterior side, and you will also encounter the tail of the pancreas and both the splenic vessels. Take care, this is a vascular ligament. You can perform finger dissection or plant dissection, but it contains very important vessels, which is the splenic artery and vein, and also the tail of the pancreas. So take care while performing dissection in this area. The pancreatocosplenic ligament actually is not a true ligament. It means if the tail of the pancreas doesn't reach the hilum, it will be connected with a small part, which is the pancreatocosplenic ligament. It may be not found if the pancreas is long enough to reach the hilum. Pancreatocolic ligament, actually number 5, this one is a part of the transverse mesocolon. Here's a Splenocolic ligament, which another important ligament we will talk about. It's it may be containing polar vessels. It's number 6, like right here. It's between the spleen and the I'll remove the picture, yes, to be more comprehensive. This is the Splenocolic ligament. It connects the lower pole of the spleen to the splenic flexure. Actually, it may contain, as we said, a polar vessel, so take care while dissecting here. And also, when you are performing a left hemicolectomy, you are also incising this ligament to mobilize the colon. Actually, also traction in this direction may cause avulsion of the capsule of the spleen and may cause a marked bleeding, so take care while performing traction in this area. Perisplenic ligament actually is not obvious in this diagram. It's here behind the gastrosplenic ligament. Number 1 is the gastrosplenic and number 7 is perisplenic fold. And at last, the phrenicocolic ligament. Actually, the phrenicocolic ligament is not attached to the spleen at all. It's between the splenic flexure and the diaphragm. It's the junction between the mid gut and the hind gut here in this part. It's keeping the splenic flexure hanging in this side, but it's important because our relation to the spleen, because it directs the spleen in this direction when it's enlarging. Actually, it can be called the splenic floor. The spleen is resting on this ligament, and when the spleen is enlarged, it will be enlarged this way, not downward. The downward enlargement is blocked by the phrenicocolic ligament. So the enlarged spleen can reach up to the umbilicus and the mid-abdomen, not to the left paracolic gutter. Another importance of this ligament, it prevents blood from ruptured spleen or any cause of bleeding in this area from entering the left paracolic gutter. So a traumatic event in this area and the splenic rupture the blood will be confined to this space, the left hypochondrium space, and not propagating to the left paracolic gutter. So this is the most important ligament of spleen. We will just to remember them. Here's the gastrosplenic ligament. From here, it's like triangular. Oh, I missed. Okay, it's like this, a triangular ligament. Here, it contains the short gastric and the left gastroepiploic. Here's the lienorenal ligament, or the splenorenal ligament, containing the hilum or the hilar vessels and the tail of the pancreas. Here's the splenocollic ligament in the lower pool, and here's a Splenophenic in the upper pool, and here's the floor of the spleen, which is formed by the colophenic or Phrenicocolic ligament. which directs the spleen in this direction. This is the most important ligament regarding the spleen. One last information you should remember, that the tail of pancreas lying in this area, so careless division in this part may result in pancreatic fistula, and it's really a nasty complication to happen. It may take few weeks to months to close down, so really take care when you are incising or dissecting in this area to make sure that the pancreas is safe. Thank you for listening, and see you in another videos. Thank you.